The McLean Clinic offers a wide range of both cosmetic surgery and medical aesthetic procedures tailored to meet your individual needs. Dr. McLean is here to share his philosophy on how cosmetic procedures can improve your physical and mental well-being. This is Daily Web TV. Electing to have plastic surgery is an important decision, and equally important is to research the qualifications and background of the surgeon you will choose to perform the procedure. We're discussing this today with Dr. Hugh McLean of McLean Clinic. So Dr. McLean, please tell me a little bit about the background of your clinic.
My clinic recently had its 20th anniversary.
20 years.
Yes. And when I founded the clinic back then, my idea was to create a center of excellence for cosmetic surgery in Mississauga. I had trained as a plastic surgeon. I became certified in Canada, and then I became certified in the United States. And I did some training in the United States as well, specifically in cosmetic surgery. After that, I actually visited many cosmetic surgeons to see how they practiced. And at that time, the clinic idea was really just in its infancy and people were developing it. Lately, one of my mentors, Dr. Harold Silver, who was very valuable to me at that time, has retired. And I've taken his personal practice, I've wound it down, and I'm looking after his clients and adopting some of his very unique techniques.
But you yourself have been practicing right here for 20 years in this clinic.
Exactly.
Now, why is it important to have accreditation?
Well, accreditation means that a facility or a surgeon has gone through the standards and the requisites to achieve that. For example, in a facility, my facility is accredited, amongst other things, by the Ministry of Health of Ontario. We get inspected. We have regulations. We have to make sure that safety is taken care of. And as far as a surgeon goes, a surgeon should be certified. In Canada, we're certified by the Royal College of Physicians and Surgeons.
How can someone check a surgeon's credentials and accreditations?
Yes, you can find out who a plastic surgeon is by going to the website of the Canadian Society of Plastic Surgeons, for example. You can also check on doctors' qualifications through the College of Physicians and Surgeons of Ontario if you're in Ontario.
Now, what about confidentiality?
Well, confidentiality is something that is extremely important, especially in cosmetic surgery, but it's important in medicine in general. And we're very careful with our records, with our telephone calls, with what we put even on the envelopes if we send a letter out.
Now, I know that you happen to have been the head of plastic surgery at Trillium Hospital. That's quite the role and standard to have for a plastic surgeon. What all do you offer here, having that type of background? What types of procedures?
Well, a plastic surgeon makes his reputation on his successes, not his failures.
Right.
And so what I wanted to concentrate on was areas that I felt I could be most successful in. And there's a huge range in plastic surgery of things you can do, even hand surgery, for example. So I've narrowed into cosmetic surgery, and even within cosmetic surgery, I've narrowed down to mainly faces, breasts, and tummy tucks.
Now, do you do your procedures right here?
All of our procedures are done here. And part of making things easy, let me give you an example. For example, in a tummy tuck, when we do a tummy tuck, most surgeons will put in tubes called drains to suck out fluid. We've developed techniques to avoid having to use drains. Some surgeons will use staples to staple the wound. We don't do that. We want that scar to be as nice as possible, so we take a lot of extra time to put in buried dissolving stitches, and then our patients don't have to have stitches removed. And we apply that to a lot of our techniques, and say with a facelift, we often don't even put a dressing on. People can go home without a big bandage.
And in those areas, is it all cosmetic, or are there other procedures that you perform?
Well, generally I perform cosmetic procedures. There are some exceptions. A breast reduction, for example, is not necessarily considered purely cosmetic.
Some psychological factors involved.
Well, usually pain, neck, shoulder, and back pain in a breast.
From very heavy breasts, absolutely,
Exactly.
absolutely. So what can one expect when they come to your clinic for procedures?
Well, what we want to do is to make the experience not only private and comfortable, but actually enjoyable. We want it also to be easy. We have a slogan, "Beauty Made Easy," and we try very hard to have the whole experience very straightforward. People don't have to worry about what to do next because we know what to do next and we'll tell them and we have everything organized for them. For example, all the instructions that people get afterwards are given to them ahead of time. We don't wait till afterwards.
So they can ask their questions then as opposed to later when they're recovering.
Yes, and our nurses are very good at doing preoperative evaluations and assessments and at teaching. We want to cover every base even before the procedure is done.
And those procedures are done right here.
Absolutely, and that's a huge benefit for the clients because it's private and they're not coping with hospitals.
There you go, 20 years of experience, and you can find that at McLean Clinic. If you'd like more information, please go to McLeanClinic.com. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.